Welcome to the Edelheit Experience, a compelling conversation about revolutionizing health and well-being, bringing you rich stories and lessons learned from leading corporate executives. Now, we'd like to introduce your host, Jonathan Edelheit.
Welcome to the Edelheit Experience. I have I feel, one of the top personalities in the entire self-funded healthcare employee benefits space with me today. I have Lee Lewis. Lee, thanks for joining us.
Hey, absolutely. Thanks for having me.
So Lee, tell us about yourself. I think you're one of the most unique people and most brilliant people in the industry.
So I don't know about that, but I might take unique maybe. Thrilled to be here. I am the Chief Strategy Officer currently at the Health Transformation Alliance. Prior to joining the HTA a couple of years ago, I was a consultant with Gallagher out and sort of ran a large employer practice and ran the innovation lab out of the office. And then also prior to that, I learned healthcare inside a TPA. And here at the HTA, we have about 60 large employers or household names that make up the Health Transformation Alliance. We have about 5 million total lives and spend just under 30 billion per year. And hopefully, if we're really successful, that'll become a much smaller number as time passes.
I love that attitude of it's if you're successful, that number is reduced. Now, do you get excited coming in every day trying to make that dream come true there, or is it stressful trying to bring costs down and to make an impact?
Oh, it's hugely stressful, but I absolutely love it. I have the best job imaginable inside of healthcare. Every day, it's thinking about saving lives and saving dollars, and it's pushing back against practices that are not helpful for American families, and working to help bring rational, regular business decision making into a space that has not had any of those logical influences for a long time.
Do you think that your HTA is really unique in that and in what you're doing and taking that approach, versus others that are just focused, more on the status quo and just doing the same thing again and again?
So I would say that the HTA is not unique in mission. There are many organizations, wonderful organizations that have the exact same sort of mission, or if not exactly the same, that we're absolutely mission aligned. Your own organization is a perfect example around costs and culture and care. Absolutely, we are aligned around the triple aim. What makes the HTA unique is that we are fully owned by our members. So it's not that our members are just our participants or pay a membership, like a membership fee at a country club or something like that. They are fully owners of the HTA, and all of our staff work and serve only that constituency, so the large employers. And that's a little different than what I was able to do as a consultant, where I had a constituency of my clients, but also my leadership and my shareholders. And there were many different business relationships that existed throughout the consultancy that were all important and all had influence on how I did my job. Here, it is just for the employers. And in addition to that, we are solely focused on trying to develop and evolve the types of solutions that will change the way care is delivered in the country.
And when you talk about evolve, you've been at this a long time. How do you see well-being, how it's evolved over time? And, is it truly evolving or just circling back in different ways?
Yeah. I think we are getting better and we're getting smarter. So in, call it, the early teens or so, we had wellness was really thriving, and it was mostly the early days wellness is like walking challenges wellness and, apples with a measuring tape wrapped around them, right? Then we progressed to, I think, total well-being and holistic well-being, where we started to add in financial well-being and career and mental emotional. Then I think we matured maybe a little bit more and became more clinical, and that turned into diabetes, and sort of the birth of many different clinical point solutions was realized. And you have diabetes programs, which became diabetes and pre-diabetes, and then also your mental health programs, and second opinion and cancer and fertility, and all these different programs are coming in, all of them helping take care of the entire patient, which is aligned with the early goals of wellness, but doing so in a much more robust clinical way.
Now, we're seeing a lot of like hybrid solutions out there.
Yes.
And I feel like, some there's rhyme or reason, some are just, I think, just mixing and matching to differentiate. Is, what are your thoughts on where we are with these multi-category or hybrid programs? Is this just the newest fad, or is this the industry evolving to the next level?
I think it's cycling. So 15 years ago, you had one insurance carrier and it did all your pharmacy and all your medical, and it was kind of its thing. Then it sort of split out your pharmacy, your PBM, et cetera. Then we added in wellness and telemedicine and second opinion. We added in navigation and diabetes and pre-diabetes and fertility. We then added in, now we've got pharmacogenomics and gut and digestive health. We have EAP and mental health and children's mental health and children's weight loss. And there's been this explosion of complexity. And now I think people have said, we've swung quite a ways away from just one carrier that does everything for everyone. And now different vendors are starting to sort of come together to create kind of hybrid type solutions. There's examples of vendors that are combining mental health and diabetes, or gut health and diabetes, or mental health and MSK, or chronic pain management, which seems to make sense as well. And they're starting to bring those together. You also see where the early days of, say, transparency companies like, say, Castlight, then became transparency and engagement, then became transparency and engagement and direct primary care and on-site clinics, right? There's as they've sort of come together. You saw the same thing with Accolade going from navigation to navigation plus center of excellence, navigation, center of excellence, and second opinion. You see it with Grand Rounds going from second opinion to also navigation and customer service, and also telemedicine, and it's sort of expanding as well. So everything's coming back together, sort of like the Big Bang and then the Big Shrink, where we sort of exploded into a universe of many different complexities, and now it's starting to regather. And it could be that in another 5 to 10 years, all of them sort of collapse back together to create another big health plan that's all in one. And then perhaps the cycle begins. I hope that we evolve past these things, but that appears to be the trend.
I feel like you're one of the more unique people in the industry in how you make choices in a very straightforward way with solution providers, and, in making sure that it works, not like taking risks that might not pay off, or go with something just because it's the new fad or it's popular. So what would be, like the three secrets of like how you evaluate a vendor, if they're a secret, or just, how do you evaluate going forward? Like what do you look for?
Oh yeah, no, I'm glad you asked. So I'm tracking 86 categories today with about 330 solutions that work with large employers. The very first thing I want to do is I want to eliminate categories, because if I eliminate one category, I might eliminate 5 vendors and 1 RFP, which is a pretty good return on investment, right? Is eliminating all of that work in 30 seconds by analyzing a category. So the way I eliminate categories is by looking at the category and saying, do we have, at least around a 1% impact on my claims? Do I think that this category can have about at least a 1-ish% impact on my claims, and overall budget? Or is it treating a really critical need that is experienced by a meaningful number of people? Anything that doesn't meet that minimum threshold, I'm going to set that to the side. And I call the heuristic, the way to remember it, 1, 2, 3, 4, 5. So number one is, does it impact at least 1%? Does it impact at least 1% net on my budget? 2 is, do I have a minimum 2x guarantee? Now that is a vendor specific issue, but once I've found categories that have a meaningful 1% or greater impact, I've got a handful of categories that I think are meaningful. Now I start looking at the vendors in those categories. Can you give me a 2x guarantee? Number 3, and I want all your fees at risk if possible. If I'm going to be taking the risk as a purchaser of trying something new, I want you to take the risk of my financials and my time. And many people say, well, Lee, I give a 1x guarantee. Isn't that good enough? No, that is not good enough. Why? Because it may take me 9 or 10 months to sign a contract with you. And then I've got to spend 6 months implementing you. And then if at the end of all that, all you do is give me back my money, what about the year plus of time that I'm never getting back? And that's an opportunity cost for a program I was not able to do. So no, 1x guarantee is not enough. I want 1x on my money and another X for my time. Number 3, I want to know that you have third-party validation with using good math. If you're just comparing participants in your program to non-participants, that is not good math. That's called volunteer sampling bias. And by using that mechanism, I can make any program look good, even if it does nothing. I just have to find the people who are willing to raise their hand and say, yeah, I want to try something new, and then follow those people around for a few months. Guess what? They're going to be better at their jobs. They're going to be more active in their healthcare. They're going to have lower costs. They're probably eating healthier. They're trying new things. They're poking the universe to make things better. Those individuals who at any given point in time are willing to raise their hand and volunteer to try something new, they are going to have differentiated impact, and it has nothing to do with my program. So good math, third-party validation. Number 4, I want a expected 4x return. Now, I already got a guarantee of 2x. That is not the ceiling, that's the floor. I want an expected 4x. Why is that? 2 reasons. 1, every CFO in the land is not going to do an acquisition unless they think there's about a 4x return on that capital investment. And we within benefits need to hold ourselves accountable to the same rigorous financial measures that are undertaken by other areas of our businesses. We owe that to ourselves and our professionalism and our ability to have a seat at the table with the CFO and to be able to substantiate the ROI and the plan management in which we engage. Second reason is because if we ever want to fully transform care, we need to catch up with the other leaders in the world. Who are the top leaders? The Michael Phelps of healthcare globally are these countries: Singapore, South Korea, Japan, Hong Kong. Very expensive countries, very high rent, high cost of living, but they live a long time. They've got an 84-year life expectancy. That's 6 years better than the US. And they are spending cradle to grave about $2,500 per year on their citizenry or better. Singapore is almost half that. They're the gold medalist globally. So how do we catch up with that? Well, it's 4.6. If we could replace every dollar we spend in healthcare with a program that has a 4.6 ROI, we catch the gold medal bracket of global healthcare. And then number 5 is, hey, can you do all that with 5th grade math? If I have to hire an actuary to see what your ROI is, not interested. Plus, minus, multiply, and divide. That's it. We want good, concrete numbers.
Are there a lot of vendors that meet all that? Is it like hitting the lottery?
Gloriously, no, there's not that many that hit that. And that makes it very doable. So if I start with 86 categories, there's probably 15 or so that are meaningful. So, okay, I can wrap my head around 15 categories. I don't want to do 15 RFPs though. So let me rank stack those categories from the biggest one. So if you look at the entire US population, orthopedic, back, joint, spine, and sort of chronic MSK conditions, musculoskeletal conditions, is about 15% of spend. So that's the biggest category. We can start there. So my next category is cardiometabolic diseases, that they make up about 12% of total spend. And that hits all your diabetes, your heart disease, your kidney disease, your strokes, hypertension, et cetera, fits into that bracket. But those two categories make up about 27% of US healthcare spend. I can wrap my head around that. I can tackle two categories and hit over a fourth of my entire annual budget. That's a pretty good use of time. So we rank stack the sizes of the categories and then what we think we can do to impact them. And then we look at all the vendors. Luckily, in each of these categories, there's a ton of different vendors there. And we start running them through the kind of 1, 2, 3, 4, 5. And usually we shake out one or two who can kind of reach those aspirations or hope to. And in some cases, there's barely one, and we don't even have to really do an RFP. In other cases, there's a few, and then we've got to do more of an RFP type analysis. But we can avoid a lot of RFP months wasted by putting a really high standard and eliminating entire categories if needs be.
You think it's easy for, the average employer to try to accomplish what you're doing, or they really need to be a part of like an HTA, to have that brain power and that clout of the size to be able to accomplish that stuff?
I want to say, hey, anybody could do this, but probably can't. The only reason I'm able to do it is because I study the industry for 80 hours a week, and I'm a zealot for what I do, and I don't have any other hobbies. So that's not exactly a pitch to have me as a good friend, but I'm good at helping in this area if there's anything that I'm good at. But that allows me to probably spend a lot of time on this that a benefits manager is not going to have the time to do that. They've got 100 other demands in their organization. They've got many different stakeholders, from the controller side of the house to everything that's coming in through short and long-term disability and procurement and everything else. I think it makes it really hard to follow all this. Unfortunately, it probably is not very easy.
How do you find, let's say, the solutions or the vendors that are, able to achieve what you want or aspire to do it? Meaning, like, I'm assuming you're not just picking up your phone all day long, receiving emails and just, all the, thousands of vendors out there, you're just taking all their calls. Like, how do you even find out about, somebody? I know you said you're spending, like, what do you say, 70 or 80 hours a week researching the industry. But I'm sure that can't be, easy.
Yeah. And even if I was taking calls all day, I would not be able to keep up with everything that's going on. So my method is I have to take 2 or 3 phone calls from different vendors in one space to get really good at that space. And I listen to vendors not to judge them, but I study what a vendor does well enough that I can explain it back to them as good as if I worked for their firm. That requires me to take really good notes during vendor calls. And that is one thing that I've had to learn is I'm taking relentless notes, and I'm saving those notes always inside, kind of the database in order to get good within a category. Also studying the problem. Vendors like to immediately jump into what their solution is. In most cases, I'm not actually that interested in your solution. I want to understand what the problem is and how you think about and quantify that problem. If you can teach me that, that's a skill that I can take with me into any other interaction. So if it is, if I'm visiting with someone on Something I'm working on right now is dialysis, right? So in visiting with a vendor, I hound them around the problem because I want to understand it. What is the percentage? How much does dialysis cost? Found out 1.6% of my budget is going to dialysis for about 0.1% of my population. That's a really small number. That's 1 in 10, like 1 in 1,000 people. That's not a lot of people, yet it's costing over 1% of my total medical budget. That's huge. And so that's really helpful to know. Then I want to know, what are we doing to solve it today? Why is that a problem? Well, it's a problem because we're not getting people transplants who need them. Transplants are doled out many times more often for people who are either wealthy or white versus people who are not as wealthy or of a minority or underrepresented group. That's a major imbalance that we want to tackle and eliminate. We also know that people receive dialysis in a center versus receiving dialysis at home. It's 51% less costly to receive dialysis at home. When was the last time you door dashed anything and it cost 51% less to get it delivered to your home? That's the reality in this particular cost area. Now, not everyone can get dialysis at home. Nevertheless, many people who are told they can't get dialysis at home are getting that advice from someone who owns the dialysis center and doesn't want to reduce their income by 51% to make it more convenient for the patient, or at the very least is conflicted. Let's just acknowledge that. So this is really interesting, right? Like, you can sink your teeth into this problem when you start to peel back the onion of all the challenges that exist with it. Many people crash into dialysis with a traumatizing event that leads to inpatient care where you're fighting for your life. It's deadly and it's terrifying. Those can be virtually 100% prevented if we can make sure people are getting to a nephrologist and getting the right preventive care ahead of time. So anyway, these are all ways that you can analyze a problem, take good notes on it. And then once you've done so, you can very easily judge whether or not you want to spend any more time on it. And then for me, I never take another meeting in that vertical again. If it's a category that I feel like I have a good understanding of and that is not for me. And that allows me to rapidly cut down on the amount of meetings that I need to take or feel compelled to take.
I feel like you could probably give like almost a guidebook, or an encyclopedia of this industry, probably with all the verticals that you've checked out. Is I look at this and say, for example, like, you probably have this, amazing knowledge of resource in your mind. And there's probably others out there that have, in very specific niches, resources. Like, how are we going to solve our healthcare issues? In the future, will there be some type of way to crowdsource this, with the knowledge that everybody has of what's actually working?
Yeah, well, you're overly generous, I think, to me, but there's great information everywhere, and nobody even has a majority of it, let alone a plurality, or all of it. The concept in my mind is that that's part of what we do at HTA. We're bringing together leading employers like, Boeing and Linde and Verizon and Shell and many, many others that are household names, that are sophisticated and that have great leadership, that are working on these problems every day as well. And again, nobody has all the knowledge or all the answers. And so by sharing with each other, it helps a lot for us to be able to learn new ways to help families. But in terms of like one guidebook in one place that gives us a lot of information, man, I wish that existed, because it'd be terrific. And then we'd be dismayed because within like 6 to 8 months, it would be, 40% of it would be obsolete because things move so quickly. So yeah, I wish there were a better answer there.
Yeah, and I love your analogy with the dialysis, because it's the kind of, hey, if I had to get it, I think I would want it at home. I would want to go to, a center to actually get it. Do you think at some point employers may come together and that are national employers and somehow invest or launch their own solutions that could deploy for them? Or is that something that's like, they're not built for it? The Amazon and, Chase and all them came together, we were going to solve it. And then all of a sudden, everyone expected some magic to happen and then it disbanded.
Yeah, it's really hard to do. And I think making a new organization, I go back and forth on it. I don't know what the right answer is. If we make, it's hard to ask benefits teams to do more than they're already doing. They're stretched to the limit. They're doing more with less. When times are tight, seems like they're the last department to get approved to hire new people. They've got tight budgets on consultants and or brokerage where they might be able to extend their teams. It's really hard. So are they should we also put on them, hey, also we need you to create the brave new world organization that's going to transform a sixth of the economy? I mean, oh man, some of them probably could, and they'd be the right people to do it, but I'd feel awful asking them to. So I kind of hope that it's through small and simple practices that we ideally make really easy for people to employ that will cumulatively add up to a lot. I sure hope so, because if not, I don't know how we are going to change healthcare. We ourselves will come crashing into a single payer system, and we'll lose the chance as employers to have a say. And I think that would be a big tragedy.
When you were talking about the benefits leaders, do you think, this concept came up a few months ago, but in an organization, they're bonusing, commissioning executives or, salespeople, business development people. But the people in the benefits area, the well-being area that potentially implement a solution that saves a ton of money or has some kind of big impact, there's no incentive for them. And there's no incentive for them to take risks. Do you think that's a mistake? Do you think that's an area where there should be some kind of a bonus or compensation or better recognition for, them making decisions that actually save a ton of money or somehow, transform the company? Or is that going into murky waters that could create other issues or problems?
No, I think two of the best things that any financial leader, executive, or CFO can do, and hopefully there's some listening to this podcast. Thing number one, you should expect more from the benefits team in terms of financial management. Most benefits people are working really hard. They're smart and they're creative and they want to do the right thing and make a difference. But if they have one person in the executive suite whose spouse or child maybe has a problem getting an ID card or something because of a change they made to save millions of dollars, the value of those choices is often ignored, and even small inconveniences end up having major negative consequences, which sends a message: do not take risk. Do not try to do things that save money. Also, if they save 10 or $20 million per year in some cases, they're not getting a single bonus. They're barely getting an attaboy or an attagirl. But if they have, one inconvenience that comes up, it could be, job probation. I mean, it's so imbalanced. So how do you fix that? Treat these people as the professionals that they are. Bonus them based on performance of the health plan. And that's not just, we got another 5% per year trend. The goal ought to be, let's flatten trend. Let's see if we can get flattened trend without passing a penny of additional cost to our members. That's hard to do, but it will force you to do some research, to find some good solutions, to use good math. And that will cause us to expect more from our vendors, which will generate better ROI. And guess what? It'll generate better vendors too. If we don't get what we don't ask for. And it'll make us hold all of the point solutions to a much higher standard, because we will be held to a higher standard. And guess what? Our companies are going to save lots of money. They're going to be able to hire more people, grow, make acquisitions, because we're managing the health plan like any other budgeted area of the business that can be impacted by good business decisions. And then bonus your people, hold them accountable, and give them the chance to be the business professionals that they want to be without being constrained so much by not having anyone look or anyone care what they're doing. Second thing that you should do is allow your benefits people to hire engineers and accountants to work in benefits. Many of the highest performing teams that I've seen within HTA are cognitively diverse, which is to say somebody has a low risk tolerance and somebody else has a high risk tolerance. Somebody is a creative, another person is good at systems. Somebody is an engineer while somebody else is an accountant, and somebody else is good with EQ versus IQ and is really good at messaging and communicating. And when you get cognitively diverse teams, and I'm not saying, not have a diverse team as well, but sometimes just having a really diverse team where everyone is cognitively more or less aligned, you're not getting the full value of diversity. And it is critical that you have different types of personalities, backgrounds, and experience within the health and benefit space.
I completely agree with you on that. I almost feel like there needs to be a transformation or a viewing of this area differently, because if you have that kind of diversity, within that department, people are going to be able to solve things, see things that others can't, and they all complement each other. And I think there is kind of this misalignment of, how well, the benefits people do and how they're rewarded. And also, like you said, of how the hammer comes down on them, if they make a choice and there's some kind of minor inconvenience to an executive, their doctor's not in the network, or, their wife's doctor, or as you said, they have an ID card issue. I think it's and the fact that healthcare costs so much and is going up, I feel like it's this one area that the company should put more priority on, and rethink about how they look at it.
Yeah. And I'm not saying people shouldn't have a great member experience. They absolutely should. We should deliver delight to our employees. Nevertheless, if people are not allowed to try new things, if there is a dread around even the slightest disruption, then we will be stuck with 6% cost increases forever.
I completely agree. Well, thank you for joining us today, Lee. It's always a pleasure.
No, my pleasure. And thanks so much, Jonathan. And if anybody is interested in learning more, I work for a co-op. It's owned by employers. We don't have a profit motive. Our mission is completely to try and help make American healthcare better for people, to save lives and save dollars. I am happy to share anything and everything I know with anyone who is any benefits leadership who's interested in learning or having that. Feel free to reach out anytime.
Great. Thank you.
Thanks. Take care.